The measles outbreak in Adamawa continues to escalate. Now, the state epidemiologists reveals that since January, there have been 818 reported cases of measles outbreak in the state, out of which 143 cases have been confirmed, resulting in 49 fatalities. Most affected by this outbreak are children aged 1 to 14, leading to the closure of primary and secondary schools in the state.
Most of the children that were affected, most of them they are highly immune, and they are unvaccinated. And this unvaccinated came about those people that move from other locality to Adamawa State, and they are non-compliant to vaccination. And when this outbreak occurred, the disease has now caused a lot of havoc to such kind of children, of which we lost many lives, and those of them that have died are the ones that refuse to accept vaccination.
Recognizing the severity of the outbreak, the World Health Organization, WHO, has engaged journalists as crucial stakeholders in managing the health crisis, emphasizing on the importance of responding to health emergencies to save lives without leading to panic among residents.
Now in Adamawa State, we have outbreaks of measles here and there. Prevention, they say, is better than cure. But also when you are affected, the measures you take can also help whether you progress to death or you recover with minimal damages. So what you people report is very important to us. And one of the aims here is to ensure that you report what will save lives. But nobody reports what will cause more deaths.
I'm telling you the truth that the information that we received here they're kind of an eye-opener. They are so new, they are so fresh. We hope that we're going to have more cooperation, especially coming from the state.
Caregivers are also advised to promptly seek medical attention at the nearest health facility if their children exhibit any signs or symptoms of the illness. Governor Ahmadu Fintri has also taken action by intensifying health response surveillance and forming a team to raise awareness among locals. Sama Mudidan, Arise News, Yola.
I'm joined now by the Chief of Health of UNICEF Nigeria, Eduardo Celades. Good to see you, and well, this is really scary looking at the numbers. First, let's establish, when we talk about measles, sometimes you don't even know how to identify them. What's the measles? What are we dealing with?
Right. Well, thank you very much for inviting me tonight. So indeed, measles, why it's important? So it's important because it's very contagious, right? This is first of all. So it transmits very easily, normally from child to child, through sneezing, cough, even breathing, right? It's a disease that normally doesn't have complications, but it can have complications, especially if the children are malnourished, right? And in this case, we're going to see high fever, runny nose, and as well a rash that appears in the body, normally starting in the neck and going downwards to the hands and to the feet, right? As well, you can get some white spots in your cheeks and inside your mouth. Normally, it doesn't have complications, but as I said, if the children is malnourished, it can happen. Which complications? Pneumonia, as well like ear problems, blindness, and as well somehow resets your immune system, right? So you lose as well defense against other diseases, pneumonia, and eventually death. So this is what we are seeing now in Adamawa, right? We have more than 800 cases, almost 50 deaths, and in almost 21 LGAs, but mostly in 2 LGAs. So what we are seeing is a lot of transmission in those places, and what needs to be done is very easy. Is actually vaccinate the children, because as we saw in the report, most of the children that they are dying and that we are seeing between 1 to 14 years old, they are not vaccinated. They are what we call zero-dose children, that don't have any vaccine. And this is the ones more exposed to the virus.
And why is that the case? Because we had seen quite a number of push by the Nigerian government For many years down the line, talking about vaccination, and many of these children, one would have thought they were vaccinated. What do you think happened?
We're coming from a situation that was not good at all, right? So the vaccination coverage in Nigeria was very low. And actually, from last year, we have a global report that was saying that Nigeria is the country in the world with more children non-vaccinated, with 0 dose. Right? So it's a lot of work that the government is doing with the support from partners, and really reducing the number of 0 dose children and increasing the coverage of vaccination. So the work is there. Still, we are seeing like this measles outbreak. Last year, like almost 20,000 children got measles. We had like more than 180 outbreaks.
Are you talking about Nigeria?
Yes,
20,000?
That's correct, last year, as per the Nigerian CDC data. 19,500. And actually more than 180 outbreaks during the whole year of last year. Right? Many of these outbreaks, you didn't hear about them, because the best outbreak is the one that you control it very quickly. Right? And this is not, prevention is better than cure, right? A quick reaction is better than stop and see how it spreads. That's why it's so important to very quickly react and do vaccination campaign. We call it like a ring vaccination campaign or a reactive campaign. So for example, in Adamawa, more than 10,000 children, around the cases, they have already vaccinated in the last couple of weeks.
Are we dealing with an overwhelming situation, or is it something that can be contained?
It can. We really hope that with the vaccines available and with the measures in place, this will be contained. As well, the country has plans to really have a massive vaccination, right, over the next few months or before the end of the year. So we really think it can be contained. The problem or the challenge that I think Nigeria is trying to face is how to strengthen the health system to avoid these recurrent outbreaks, because this is consuming a lot of efforts, a lot of resources. What we need to do is like to reset a little bit to ensure that we have a strong health system that can anticipate these outbreaks, right? And you know that we have last year diphtheria outbreak, a very large one. Lassa fever has been happening, meningitis outbreak. So the best way is like the efforts of the government and the Federal Ministry of Health to really strengthen the primary healthcare system, so we can stop these recurrent outbreaks and we can move, right? And we can just think in other things, mental health, whatever it is, but really to move from only being responding to outbreaks every time.
And for the caregivers and experts like yourself and others who are trying to contain this, are they also at risk?
Well, many people already passed measles when they were children, so they are protected by natural immunity, or they have been vaccinated. Normally it's 2 vaccines, right? As well, it's very important, especially for children, to have vitamin A at least twice a year. Right? Because if you don't have vitamin A, you are much more at risk to get complications. Vitamin A, you normally get it through the green vegetables or orange vegetables or yellow vegetables, right? Like spinach and sweet potato. So this is as well for the caregivers that they are listening to us, that to remember to have a balanced diet, right? So I think risks are there, but I mean, with good hygiene, we're trying to avoid the transmission, right? Trying to isolate the children. If you have a child in a room or something like that, you can avoid further spread. But the most important one is vaccination.
And the vaccination, is it just restricted to children alone, or can adults who were not vaccinated while they were children also be presented for vaccination?
That's a very good question, because as well, the adults, like all adults, are at risk if they didn't go through measles when they were younger. But at this moment in the Nigerian schedule, it's for children at 9 months and at 18 months. This is the regular vaccination. During the campaigns of the response, this can be expanded up to 5 years, but normally this is for children because they are the ones more at risk. And this is basically because they don't have enough defenses, the malnutrition, etc.
So, Eduardo, before I let you go, what's the data like in terms of other states, neighboring states to Adamawa? Are they also at risk to the spread?
That's a very good question. If you look to the data, how is the situation in Adamawa? And we just had a UNICEF team that was there. Most of the cases are in 2 LGAs. One is called Gombe, the other one is Mubi North. I have not been there yet, but this is what the data show. At these 2 LGAs, they are neighboring. One is neighboring Borno, the other one Cameroon. So that's why it's so important, as you said, to be as well, like look into the bordering LGAs. Because with the outbreaks, it's very easily that spread, right? Because the transmission is very easy. And sometimes it's not, the other day we were hearing, it's not about if it's going to happen, but when it's going to happen, right? If we can really prevent and be ahead of the curve. That's why it's so important, the investments in health security, in community health workers, that they can really detect very early the outbreaks. And if you really detect it very early, you can stop as well as soon as it starts. So that's a little bit the message that I would like to pass, that if we have very good community health workers and a strong health system, Nigeria will be able to really stop these outbreaks.
Eduardo Celades, Chief of Health, UNICEF Nigeria, a delight speaking with you on Newsnight.
Same here. Thank you very much.